Always good to hear that music. That means it's the start of another Helping Seniors of Brevard. I'm John Harper. Let's get things underway with the show as I introduce the host of Helping Seniors of Brevard. And let's not forget the executive director of Helping Seniors of Brevard. Here is none other than Kerry Fink. Kerry, I hope you're enjoying that music of your life.
It's all good. It's all good, John Harper, and thank you. And it's always great to be on the radio. Wednesday, we gather around the radio at lunchtime, 12 noon to 1 p.m. right here on 90.3 FM WEJF. And we also want to wave hello at everybody who's listening online, WEJF.net, and also to those of you who catch this later as a podcast, wherever fine podcasts are found. That's like Apple, iTunes, and different places like iHeartRadio, Amazon, Ask Alexa about it, and all those kind of things. It's the kind of world we live in now, right? So we were talking about the fact that we are getting ready. We're actually, I think we've set a date now, September 9th. You'll be hearing a lot about it, but that's going to be our grand opening. We're already in there and we're working. They're painting halls. There's all kinds of, you walk in there right now, there's all kinds of, what do they call it? Painter's tape over the door frames and things like that, but it's really coming together. I'm talking about a dream and a vision that Joe has had, talking about Joe Steckler, our president founder for the Helping Seniors of Brevard, since the day that he organized this organization, like literally over 12, almost 13 years ago now. And we're talking about our Senior Resource Center. It's that beautiful 5,600 square foot space that Omni Healthcare, Dr. Craig DeLegdish and Omni Healthcare made available to us in kind of their flagship building. It's the beautiful, they call it the Apollo Professional Tower. It's right there on Apollo Drive. I call it right there on the medical campus, just a block or two over from the hospital there in Melbourne. Easy to access. It's a great space. We're so excited about it. But we're just now talking about setting a grand opening date where the public is going to be invited, of September 9th. And so we thought it would be really appropriate to bring in some of the folks today that are part of what a Senior Resource Center of Brevard is all about. And I often say I love to do the work that we do in helping seniors. There's no reason for us to be here for any other reason than to serve you. We are a Florida nonprofit, which means there's no motive of somebody trying to get wealthy or anything like that. This is all about you, whether you are the senior, somebody who loves and cares for a senior, or, we always say it like this in Brevard County, where 1 in 4 are over the age of 65. You either are a senior, love and care for a senior, or God willing, soon enough, you will become a senior. So everything we talk about is going to be relevant. But one of the greatest things about going to work each day with the group here at Helping Seniors is that we get to work with the finest people on the planet. These are people who are really dedicated to the welfare and well-being of seniors in Brevard County. Now, even though all these people have companies and they work hard and they have to do the things that the business world requires, you'll also notice something very special about them. They really have a passion, and it's almost a calling where they want to take more time to be sure that the right things are happening for our seniors, almost over anything else. And so we are so fortunate to have in the studio today two of the folks who really are making all this happen. I want to introduce them to you one at a time. One is a lady whose name is Denise Bergman. And if you don't know that name, you may have seen her articles maybe in the Helping Seniors newsletter, in Senior Scene magazine, and she's making her radio debut. Thank you for being here today, Denise.
Thank you for having me. I am very pleased to be here and very excited about the new Senior Resource Center on Apollo Boulevard.
Yeah, and your company is so important in this whole mix of things. Your company is called Senior Care Authority, and you have sort of the Senior Care Authority for all of Brevard County. And it's a fascinating thing. We're going to dive into it, but you actually help people determine what the best senior living options are. There's a statistic out there that's kind of surprising to people, that there's like over 140 different senior living options, whether we're talking about assisted living, maybe it's small group living, independent care, memory care, but that's an awful lot of choices.
Yes, absolutely. It is and can be very overwhelming. And one of my biggest goals when I'm working with a senior and their family is truly from the start is to establish a rapport and to make them feel comfortable, because this transition in their life is extremely overwhelming.
Yeah.
Not only is it an emotional transition, it is a transition that not everybody likes to think about because it's scary, it's sad. So where I come in is I try to be that resource and that advocate to help them find the most appropriate senior living option that could still be remaining in their home environment as long as it is safe. So I always like to start there. Then after that, we've got assisted living communities. After that, we've got memory care communities for our seniors that have been diagnosed with dementia. And then I will say there's also independent living choices for those folks that still are able to get around and be safe. So we've got many options, along with residential homes, which are actual homes in neighborhoods that the owner has chosen to convert it into an assisted living home, but it's a smaller, more intimate type of environment. So there's many options, and I work closely with the families to determine what is the best option for their loved one.
Yeah, we're going to get into this whole topic a little bit more because, there's a thing that Joe Steckler, I'm talking about Joe Steckler, our president and founder. He's a retired Navy captain, and his last command in the Navy, he was a sub-commander in his youthful days, which is kind of cool. He can tell some really neat stories. But his last command in the Navy was actually running the Navy's retirement home in Gulfport, Mississippi. And I think that may have been what sparked his lifelong love for making sure seniors are getting the best attention, help, everything that they need to be successful wherever they are in life at whatever point in life. And so when he and his lovely wife, Terry, retired here, they moved to Satellite Beach. Joe couldn't stay retired, and he first formed and got everything rolling with the Brevard Alzheimer's Foundation. They created those Joe's Clubs, which are the adult daycares, and to this day, still named for Joe and the work and legacy that he did. But then even when Joe retired from that, he said, it's not enough. He said, what I've discovered is people have a lot of challenges beyond simply memory issues, and we need an organization that can kind of maybe tackle some of the stuff from that side too. And so that's how Helping Seniors came about. And so for 12 plus years, we've operated that senior information helpline. But the other thing we've done is to really try to educate seniors and their families. Joe calls it making an aging plan. And the best analogy I have for that is we understand hurricane planning because we live here in Florida. Does not mean that you have a plan for a hurricane because you want a hurricane. It just means you want to be prepared for a hurricane. We have euphemistically begun to call that get your ducks in a row. And so part of our whole conversation is to get people to think along those lines. And so one of the things, Denise, that we've discovered along the way is that we really we've learned, don't try this on your own. There is so much expert help, and that's what you're going to get out of the conversation we're having this hour. But I also want to stop down and introduce our other guest, who's also part of the center, the Resource Center here in Brevard, the Helping Seniors Senior Resource Center. And that is none other than, I want to get all this right, it's AAPRN, am I saying that right?
Yes.
Which stands for
Advanced Practice Registered Nurse.
Thank you for helping me out. I'm talking with Tami Leeberg. She is the head of a group called Practitioners in Motion. And you guys do a service that people who are seniors, who care for seniors, really need to know about, because you are really kind of like the primary care that comes to people's homes. I think it's a fascinating thing, and I don't think enough people know that this is even something that's available to them. In a day and age when, you're very fortunate, if you can get your appointment and then you get to the medical complex and have to have somebody get you there, somebody to wait with you there. Then you have to go in to see, and you're in the waiting room for maybe 45 minutes or an hour. And if you're lucky, you get 5 minutes with the practitioner who comes in to see you. And it's not that they may not be great, but they're doing the best they can under those systems. And yet, what you guys do is you shift it back to almost the stuff that if we ever watch old TV shows, and I was teasing about this. I was watching an episode of Leave It to Beaver, and Beaver came home from school and had a cough, and they called the doctor, and the doctor comes over. And Tami, that's kind of where you guys are at.
Yes, Kerry, thanks. That's exactly what we're doing now. So, my sister Christy and I are co-owners of Practitioners in Motion, and just like you said, we actually go to all of the places that Denise was talking about. So we take primary care into the homes, whether it's private homes. We have providers that work for us now that go into private homes. We do assisted livings. We have multiple memory care units. And then the smaller homes, we have a lot of those. And I think between Brevard and Indian River County, we are now in about 98 different assisted living / independent homes for seniors.
Wow. So first of all, that number is just astounding. You know, we sometimes see these national commercials from some company that says, "Oh, we'll help you find a place," for your senior person. And I'm always smiling because I have this same conversation. There's another partner who's in our senior resource center. Her name is Vicki Moore. She's an independent licensed insurance agent. And I was having the conversation with her. I said, people see these national, these famous people, national on TV, and they come on and they say, "Oh, call us with your zip code and we'll help you find the best insurance." So you call in to try to get that information going. And so what we find out then pretty quickly is that these people are sitting in a call center, I don't know, let's call it Des Moines, Iowa, and they're trying to guide somebody who may be living in, let's call it Malabar, Florida, to where a doctor is. And on a map, maybe they're pulling up, an online map and saying, "Oh, we have a doctor for you," and they're right over there in Cocoa. And, if you know anything about Brevard County, it's an odd little county, 72 miles north to south. And, what might look okay on a map may not actually work in person. And that's why it's so important to have somebody that really knows what's going on. So I've had this conversation so many times with Vicki Moore where she'll talk to people who maybe called that 800 number that they saw and heard from somebody famous on TV that they know and like, but then found out it really messed up, because the doctors they wanted to see, the prescriptions they're taking, all those kind of things weren't working the right way. So you really need somebody who's local. And Denise, that's really what you guys do. Somebody sees a national commercial, say, "Oh, we can help you find a place for dad," or whatever. That's fine, but they're going to sit there and try to look on a map. They haven't been to these places. They don't know what, they're reading a report, same as any of us could do, online through a search. But you've actually go to these places and you know what's appropriate. And so getting local qualified help really is the correct answer, especially when it comes to a decision as important as where you're going to live.
Mm-hmm. And Kerry, that is the reality of it. Many of the folks that call me will say that they've been in touch with some of these businesses, and in fact, they would be in touch with them, and it turns out that the communities were 30 minutes away. So that is a big difference when you're still talking about that sandwich generation that's taking care of their parent, but
Right.
yet they're still raising children and they're still working a full-time job. A 30-minute drive is a big deal. It needs to be something that's closer to their home so that they can still visit and that it's vetted. That's huge. So yes, what you're saying is the reality of it. So to work with local folks that know the community is very, very important.
Yeah, and then when I get an understanding, because I remember as we were talking about this in the past, I said, "Is this an expensive service?" And you said, "No. To the consumer, it's an absolutely free service. It's amazing."
Yes, absolutely, and that's one of the biggest things that we try to explain to the families of our seniors, because they're typically the POAs, the power of attorneys, and we explain to them, we are here as a service to you. We are here as your advocate. The communities pay us a marketing fee. So I will spend as much time as they need to help them feel as comfortable as possible with the choices that they make.
Yeah, and I was thinking about the same thing. I'm going to direct this for Tami Leeberg with Practitioners in Motion. But this is the thing. People try to go for online searches. I'm going to find a doctor here, and then you're trying to figure out who's in network, who's out of network, and all these challenging things. And I gotta believe that as you are coming to people's homes, the quality of the care that they're able to get just rises to the top because you're in their environment, you're familiar with them because you are taking the role of their primary care person, right?
Yes, we are their primary care. A lot of people don't understand what a nurse practitioner does. everyone except for 2 in our office we're autonomous. So that means we've gone to extra schooling, taken extra testing, and we don't work with a physician. So we, and then after 3,000 hours, the 2 that are with us now that are learning, they will be able to test for their autonomy also. So what we do is we go in and we do family practice, internal medicine. The one thing that you're saying, we do give that extra care. So if you need 30 minutes of our time, you have it. If you need an hour and a half of our time, you have it. And everything, there's no cost to them either. So just like if they would go to their doctor on the outside, if they have a copay, they would have that copay. But we bill everything through insurance, and we take a multitude of different insurances. And then also what I think sets us apart is we go over their med rec. So we make sure that this polypharmacy that is huge in the geriatric population does not happen. We work with placement agencies to make sure that if say they're in their home and we're taking care of them in their home, but we see everybody every single month, whether they're sick or healthy. So we know what they should sound like. We know that they are not breathing like normal, or that their gait is a little off. And we can bring in home cares to their home. Their labs are done every 3 months. That comes to their home. And then we can work with the placement agency and say, if they've transitioned somewhat and they might need an assisted living now, or they might need a memory care. So we can work with that placement to be able to get them moved again, or for the first time, to wherever they need to be. And we do take all of that time to make sure that as a whole, emotionally, spiritually, physically, that they're taken care of. And when we were working in conglomerate companies, Christy and I weren't able to take that kind of care, which is why we opened up Practitioners in Motion.
See, there's a key word here that I think really comes down to that is so important. When you go on an online search or you call a national company, everything is very impersonal. You're just hoping you hit the right, you're hoping you hit the right button. You're hoping, I mean, we all know the first rule of internet is that everything you read on the internet is absolutely true, right? So, and then when you're looking at something, you're trying to determine if that actually applies or not. Yes. But the point is, it's really about relationship. And so when you call somebody like Denise, or you call somebody like Tami at Practitioners in Motion, you're talking to somebody that's part of our community. That's one of the things I think that's important about helping seniors. We're 100% local to Brevard. And so the key thing is, as you're moving through all these things that could happen along the way, as a senior, it's nice that you have somebody who's in the community who actually is available and who cares. That's a big deal. One of you grab that.
And the other thing too, I'll just interject real quick, is once we see our patients the same day of the month, every single month. So there's no guessing, there's no waiting. If you're sick, we get things started. So say you wake up with a cough, we go ahead and order that mobile x-ray. They come to your house, they do the x-ray, and then you will see a provider within 48 hours, and we get things rolling right away. And in saying that, if the families can actually be families again. They're not just being the transporter. They're not just taking you and sitting, like you said, for 45 minutes waiting in an office. So they're able to be family again, and that's difficult to be a caregiver to an elderly family member, to your parents or aunts, and then that's the role that it takes over, and you don't get to be that aunt and niece or mother daughter anymore. You're a caregiver. So we help stop that.
Yeah. This is really talking about quality of care all the way through. And Denise, this is like part of it, because you go to these facilities and you're trying to, when somebody calls you and says, well, here's what's going on with mom, dad, aunt or uncle, or whoever the person that we're trying to help sort something out with, you've already done all the research, so as you learn about who the person is and what their needs are, then you're able to kind of like go through, I know we don't call it a Rolodex anymore, but you're able to go through your mental Rolodex and go, well, here's a place that kind of like sounds like it would be appropriate, because that's the depth of information and research and time that you've spent in this area. Absolutely.
And I couldn't agree with Tami more. The quality is so important. Like you said, you're going into their homes, and what I love about what you do is that you see them once a month. A big population that I work with, especially with us being in Florida, are the seniors are here and their families live out of state.
Absolutely.
And to have somebody like Tami in our community is absolutely wonderful, because as we're sitting here talking, I'm already thinking of families that I'm actually going to refer you to, because especially being out of state, what I do is I talk to my families and I always share with them, after I place your loved one, I will continue to be in contact with you. And I have a family of mine that I'm thinking of that I placed months ago, and the families are still in touch with me because they're in New York State. And so they do look to me, say, hey, Denise, who would you recommend? So just like this is just a wonderful opportunity for us to get out into the community via radio. But boy, Tami, what you're doing is so important. It's just great because, you know, when I meet with my families, and to say that you have this business here now, our Brevardians are lucky.
And Christy has been here for over 30 years. I moved back and forth to Indiana, but I've been home now permanently for 8 years. And our parents are here, so this very much is our community too. And like you said, a lot of our patients, their families are out of state. Mm-hmm. So, you know, and if you know that ahead of time as what you do, you can make sure that they're in a facility that has transportation, because not all do. So I know it's just so many moving pieces that by meeting people like you, as being part of helping seniors, we're able to just take care of them as a whole, because it does take a village.
Yes.
You know, I'm so glad you said that, because that really is the vision that Joe set for everything we do in helping seniors, and the Senior Resource Center especially, is trying to get, we say it's to get, educate, inform, and connect people to the resources that are going to make a difference for them. We're about to go into our mid-show break, but I want to be sure that as we're talking about this, we have a minute here just to make sure that you can grab a pencil, jot down the names of the folks that we're talking to. Denise Bergman, who is Senior Care Authority here in Brevard, somebody that is really good to know when it comes to living options and just ideas of, like, here's where we are with mom or dad. How do people reach you? Is there a phone number, or what's the best way for them to get more information on Denise Bergman and Senior Care Authority?
Well, thank you. Well, of course, I will have an office located at our new Senior Resource Center. I'm very, very excited about that. Also, my cell phone number for my business is 321-549-9045. And I also have a website, Senior Care Authority of Brevard, where you can get some more information. And I also have a business Facebook page as well.
Oh, wonderful. And Tami Leeberg, Practitioners in Motion. That's a number everybody's going to want to jot down and get more information about as well.
So, yeah, thanks, Kerry. Our phone number is 321-216-2288. We have a full staff there that can answer your call Monday through Friday, 9 to 5. We also have a Facebook and an Instagram, which is Practitioners in Motion. We also have a specialty branch for non-healing wounds called A Cut Above. That's also on the Facebook page. And then our website is bringingcaretouYou.com.
All right, wonderful. And that music says that we're going to enjoy some music, a couple of important announcements, and be right back with the second half of Helping Seniors Radio.
Kerry, Fink, it never fails. Everybody seems to kind of nod their head, tap their feet to that music. It's a little scientific experiment I have on this side of the glass watching the guests, but that's kind of interesting. But nonetheless, let's get back to the show. Let me reintroduce the host of the show and the executive director of Helping Seniors of Brevard, Kerry Fink.
Thank you, John Harper. Yeah, and speaking of, it's great Glenn Miller music. And, back in the corporate days, John is referring to, we had a nationwide radio network called The Music of Your Life. And so we played this kind of music. It was a lot of Frank Sinatra and stuff like that. And, I always explain to people, I call it the classical music of our lifetime. We always used to joke, Mozart's been dead 300 years, doesn't seem to affect the popularity of classical music. But the truth of the matter is, when you get to this kind of music, the music of your life, it's just great. So thank you, John. It's a great theme song for everything we do. Welcome back to the second half of Helping Seniors Radio right here on 90.3 FM, WEJF, and also, again, those of you listening online, WEJF.net. And thanks for continuing along in the podcast today, because we're having a great conversation with two wonderful people who are, I would say, 100% local, 100% dedicated to seniors, and 100% we're happy to have them in the Helping Seniors family. I'm talking about Denise Bergman with Senior Care Authority. Her business is one of those that is so important that you know about, because a lot of times something happens. Ideally we plan ahead. That's what we're all about, is trying to give you tools to help you plan ahead, because how many of us understand that when we are able to plan ahead, we have a lot of options, but sometimes if we wait too long, a situation presents itself. Now we're trying to pick between a couple of very, very difficult and maybe not so favorable options. And so, Denise, that's what your company does, is you help families figure out the best place for mom or dad or aunt or uncle. But the key thing is that, unlike some of those 800 numbers that we see from time to time on TV, you're here. You're in the community. You walk through the front door of these places. You know who's good, who's doing right by seniors, and that's the important part of this, right?
Yes, absolutely. And the way I run my business is I run it as if everybody that comes to me is my family. So how would I, work with my family? And in a previous life, I was a speech therapist. So I did that for many, many years. I've always worked with families. So I'm very big on communication. Communication is key. So during that initial intake phone call, I spend as much time as I can, and I'm typically on the phone with the family members, the son or daughter of the senior. And we take an in-depth phone call. I look into the history of the senior. We look at budget, we look at medical, we look at all the things that's necessary and that what matters most to the family to start coming up with a plan, okay, with that aging plan of where we're going to start touring. So I take great pride in making sure I know about the local communities and where I think would be safe. My biggest thing is safety and quality. So those are the things that I look at. So being local is very, very important.
We have also in the senior, because we're all together in the Senior Resource Center of Brevard. That's that beautiful new facility located at Omni Healthcare, where they were so kind to make available to us a really a good sized space so that we could kind of pursue Joe Steckler, our president and founder's vision for having a lot of resources under one roof. Whether people actually come to visit us there, which we encourage, but also just as a kind of a hub or nexus for all the stuff that we try to do so that we can keep up with everything that's going on. But the thing I was going to say is one of the attorneys, elder law attorneys who's partners with us, and part sponsor of the center as well, is Rhodes Law Firm, Ruth Rhodes. And, every time I sit down with Ruth or Greg Schwendeman, who's another attorney in Ruth's office, they always are talking the same thing to me. They're talking about the fact that they really want to see people ahead of time, because that way they can help them explore a lot of options. Time isn't pressing on somebody. There's no crisis that has to be solved in the next few minutes. There's time to make really good decisions. But the point is, they also talk about the people who try to do stuff on their own, and oftentimes it absolutely costs them at the time they can least afford it, because they may try to go online and do some legal papers or something like this, make a decision, then something happens, and then they come to the attorney's office and say, well, this didn't work when I went to the bank, or this didn't work when I went to the doctor. And that's a horrible time to discover, because that few $100s or whatever you paid online really wouldn't have cost any more to get some expert local advice to it. But then it's going to work at the moment you need it. And I was thinking the same thing, Denise, talking with you, is like, especially if it comes up on the sort of like, well, it's not safe for mom to go home by herself. We got to do something different, and we got to do it quick. Somebody doing a Google search might get mom landed in the wrong place, then find out that's a mistake, and then have to go through all the trauma of moving again. And see, getting with you would seem like you're taking the time at the outset, even if the time window is narrow, to make sure we get the right fit, right?
Absolutely. And when I work with my families, I'll say, what's your time frame? Because then I'll know from that question, are they planning ahead, or are we in a crunch? Are we crunch time? So obviously, I love getting those calls from those folks that say, you know what, I'm just planning ahead because I could see my parent is declining, and so I want to know what my options are. And I'm like, this is wonderful because we could take our time, and we can start looking around. I accompany all of my families on the tours, and in some situations that I've worked with families where it was a little bit opposite, where the child actually did live here working full time, and the senior lived in another state, and they wanted to move their mother or father here. So I've had those situations as well. So I would tour with the child, and then what we did was we would actually do a FaceTime video so that the senior in the other state could also quote unquote tour with us. So we would do that as well, and that has worked out well, especially with today's technology, so that the senior felt comfortable that they weren't just going off the word of their son or daughter, that they were with us on the tour on FaceTime. We would walk right around the community, show them, and we've made decisions that way as well.
That's so important because it's really getting everybody involved in the decision making process. I was thinking too, like we were talking about during the mid-show break, Tami Leeberg with Practitioners in Motion. Your company is really so. I think you guys are going to get busier and busier because you are really. I was just thinking when I first heard about what you do, you actually can provide all these services for seniors in their home, from the medical becoming their primary for that, but also with the lab testing and the different things that you're able to do. I think I mentioned this. I was remembering when we were caregivers for our mothers and how we would try to fit into our schedule because they could do a test at a certain time at a certain place, and now we had to run over to this doctor at this place. And then you'd run back to the primary care, have that appointment to see what they said when they saw what that was. And then, we have to, by the way, you have to go to the, it's a true story. You have to go to the hospital and do a PP test, and you do that. And then, it's not the right time of day, so it doesn't work for mom. And then we end up having to take the little hat home and go through all that and then take it all back. And, if you are a busy person and you care and you love for that loved one, at the very least, it's taking a big chunk of your day, and at the very most, it could be really cutting into stuff that's causing a lot of problems. And Tami, what you and Practitioners in Motion do is you really solve all that, and you improve the quality of care for the senior as well. It's like it's like the best combination ever.
We do. Thanks, Kerry. Christy and I have 6 other providers that work for us, and you were bringing up like the urine test. So we work with a lab called Patient Choice Labs. And so if your loved one, whether they're in their private home or in a assisted living, we have a collaboration with that lab. FedEx comes and picks up their urine. So they get to pee in the cup when they have to pee, not on demand, because most of us can't do that.
Right.
And then there's a number that they call if they're in their private home, and they will come and pick it up, and it's sent to the lab. Not only that, but the latest research shows that PCR testing, which is what we do, we have test results in 24 to 48 hours. So there's not any of the old, like when I started nursing, you had to wait for a culture to grow for 3 to 4 days, and then you were started on an antibiotic, but that one wouldn't work, so then they had to change it.
Oh, wow.
We've taken away all of that. So things like that, really, it's just better quality of care all the way around, and it saves the family and the patient a lot of time and stress and struggle. And then also I wanted to mention what you were talking about, Denise, as far as planning ahead. A lot of times, and again, we have the same, we share patients. So a lot of our patients do live out of state and they move here to be with the family member or vice versa. But the state of Florida also has a governing body that governs assisted livings and nursing homes and rehabs. They govern us. And there's certain paperwork that goes along with that. So if you're in a crunch, you need an 1823 before your family can ever even leave the hospital. Say they fell and broke a hip and then they're in rehab. And so we help minimize that stress also, because all of our providers are very versed in what legal documents different facilities need, and we make sure that that gets done right away too. And if they are out of state, we've done FaceTimes before with them, so we'll just do a virtual visit, get the paperwork done so that when they move here, there's not a hiccup. So we do work very closely with a lot of different we like to call ourselves the hub of the wheel, and all of the other things are the spokes. So we just try to keep it moving easily and freely, and take the amount of stress off of the family and our senior as much as possible.
See, that's like almost unheard of in a modern world, because each time you go to the doctor and you think maybe you really, the doctor is great, and it's not a complaint about the doctor, it's a complaint maybe more about the system, that the doctor doesn't really, because half the time when the doctor walks in, he or she is busy tapping on a computer because of all the reporting and stuff, and it's not really, you're lucky if you get just a couple of minutes to go, here's what's going on, doc, as quick as you can. There's another thing that we talked about, because you're doing a seminar coming up here at the end of the month at Buena Vida Estates. It's part of our senior education series. It's the last Monday, right?
31st,
The 31st, July 31st. And you shared this actually when we had the one at the start of the month over at Zon, and we were talking about the fact that a lot of times when people get to the doctor, I don't want to say this the wrong way, it almost becomes a social event. If you've ever been the child taking your parent to a doctor, they want to put out, even though they've been complaining all week, I don't feel good here, this is what's going on. Somehow there's this thing, I got to get up, I got to shower, I got to get dressed, I go to the doctor walks in, how you doing? I'm fine.
Yeah. And then it's let's go to lunch.
Yes.
It's a social occasion,
is.
and we're not necessarily doing what we came to do. But see, that's the cool thing about you going into folks' homes, because there's just a more real setting there, right? It's
And
not
we do truly see what's going on in the home. So when we go in, our providers are nosy. Christy and I started out with, we look in their cupboards, we look in their fridge.
Mm-hmm.
You may walk in and a smell may just knock your socks off,
Yes.
so to speak. And if they were going to their doctor, like you said, when the doctor comes in, it's like, are you hurting? Are you sleeping? Everything's fine. But when you see where they're living,
Yeah.
and it's not that they're dirty, it's that they're sick.
Mm-hmm.
Or they might, their mentation, an elderly person, UTIs are very frequent sometimes. And the first thing, elders don't have normal symptoms like you and I might have. But they might be confused, and most of them are very good at hiding that for a while.
Yeah.
So because we get to know them well, and we can catch little things like that. And statistically, even Health First had done a thing a few years ago and looked at our recidivism rate for the hospital. And statistically, we do keep our patients out of the hospital, and much more frequent than if they were going to the doctor just once every 6 months, or just because we can walk in and catch things early. So, we had one patient one time that said everything was fine on the phone. We're like, we're coming out anyway, we'll be there. And there's no food. There was no food, and we don't know how long that had been. And we ended up moving him into an assisted living with the help of placement to best suit his needs, and he's thriving now. So
that's actually another part of it, is like, especially here where this place is growing like so rapidly. So many people are moving to Florida. They don't know what's available to them. Or then we also talk about a lot of people just enter the aging world every day. There's more seniors every day. I think the statistic is like every 18 seconds or something, or every 8 seconds. I'm trying to remember. Somebody's turning 65. And so just the number of seniors is growing, but then the number of people moving to Florida is growing. And so the need for this keeps growing. And I think a big part of it is people need a way to hear about services that are going to make a positive impact on the quality of life, the continuum of care, just so that, there's a consistency. They're not running from doctor to doctor, trying to, the specialist prescribes one thing and then the other doctor prescribes something else, and each might be fine, but maybe not together.
Absolutely.
These are the things that you help prevent.
Mm-hmm.
Yes,
Mm-hmm.
absolutely. That's part of our office staff. We do check our med recs every month, so we bring those back, and we have 2 nurses in the office, and that's one of their main jobs, is just to make sure that polypharmacy doesn't happen. And it does happen. We catch a lot that way. So, we just, like I said, like to think of ourselves as that hub of that wheel, and try to keep everything moving as easily and stress-free for our seniors as possible.
Yeah, Tami Leeberg with Practitioners in Motion. And I say the same, Denise Bergman with Senior Care Authority. I said, earlier in the show, I said it's a little bit about relationships. You always want to work with somebody local who knows what's going on. You know the hospital. I'm thinking about you and the medical side. You know the hospitals. You know the specialists. You have personal experience where is going to be best to send somebody. Denise, you have been through the front doors of all these places. You've talked with the administrators. You've talked with the staff. You know where the good places are that you would want to direct somebody to. And it's totally different than if you're just, pulling a number out of a online search or maybe responding to an 800 number that you saw on TV or something like that. And that's why this is so important. So relationship was important. But the other word that popped up as we're talking about this to me is the safety factor.
Yes.
You guys are providing a level of safety for that loved one just because of how you approach what you guys do. If one of you wants to comment.
Well, I'd like to piggyback off of what Tami was talking about, how when she goes into the homes and she checks out the refrigerator, that is huge. And the analogy and the example you gave, Tami, of, when previous to what your company does is when you go out, you take your loved one to the doctor and then they say, okay, where are we going for lunch? And I'm fine. I lived that life with my in-laws.
Yeah.
My husband and I did that.
Yeah.
We would take my husband's grandmother to the doctor and it was the same thing. And we had a laundry list of things that we wanted to go over. But by Tami going into the home and seeing the actual day-to-day, this is what's happening. Is there food in the refrigerator? No, that's huge.
Yeah.
And what I see, of course, by going into the communities, what I like is when I tour my families, one of the things that the communities will allow for and plan for is that you can go in and have lunch there. And that is huge. Why? Because food is so important
Yes.
to our seniors. Why? Because it does help with socialization because they're going down and they're having meals with their friends. They're building friendships. They're socializing, but they're eating. And like Tami said, for our folks that do stay at home and they don't have anybody to shop for them, or for whatever reason, they're just not taking care of that need and they're just going for days without food. And then they go into a community and they start to thrive because they're eating properly.
Absolutely.
That is such a big part. It truly is. So just going in and touring and having the lunch that they have there as part of your tour, it makes that family feel a little bit more at ease. Like, okay, this is the quality of food we have. This is what the lunch situation's like, the dinner, breakfast. This is what my loved one will come down to. So it is a very big part of their relationship building, of what they have to look forward to. And that socialization is a huge part of, just them thriving.
No, so well said. Well, I'm going to reserve a minute to talk a little bit about our fundraisers, but I want to make sure that we don't kind of wind up with our topic today without making sure people know how to get in touch. So we've been talking with Denise Bergman. She is the owner-operator for Senior Care Authority right here in Brevard. So when you call Denise, you're talking to a real person right here who knows her stuff about what's ideas that might be helpful for mom, dad, aunt, uncle, whoever that loved one is that we're trying to work with. How do people get in touch with Senior Care Authority?
Well, thank you, Kerry. So they can contact me. My business phone, that's 321-549-9045. And if for whatever reason I don't pick up, feel free to leave me a message and I'll get back to you as soon as I can. I also have a website, Senior Care Authority of Brevard, and also a business Facebook page.
Wonderful. And Tami Leeberg, the name of your company, Practitioners in Motion. Let's get some good help at home. How do people reach you and find out how all this works or could work and help them?
You can call us at 321-216-2288. I have a full office staff Monday through Friday, 9 to 5. And if you leave a message, they will call you back. We also have a website, which is bringingcaretouYou.com. You can find us on Facebook and Instagram at Practitioners in Motion.
Oh, thank you. Well, thank you guys both for being here and also for being part of the Senior Resource Center. We're going to talk about helping seniors for just a minute. As a nonprofit, Florida nonprofit, we always have to do fundraising to keep us going. So I'm going to give you two fast fundraiser things that I want you to keep in mind. I was just talking with Chris Morse, who is the director of the Helping Seniors Travel Club, and he said, yes, you can still join us. We have it's our third annual Helping Seniors Travel Club sailing. It raises money for helping seniors. And this is what's cool. You get on the ship. It's not like somebody comes around and says, now, how much are you going to donate? No, the way it works is you get a great deal on a cruise, and the cruise line apportions money back to the Helping Seniors organization. So this is our third annual. So it's October 12th is a 3-night sailing. So if you just got a weekend, a short time, it's a great getaway. We're going on the MSC seaside out of Port Canaveral. That's the whole point, is people love to go cruising. They get on a ship, you make great friends, and then everybody, these people fly back to Seattle, these people fly back to Chicago, and you become friends on Facebook and share grandkids' pictures. But it's much better when you meet friends from Brevard County and say, let's have lunch next week. It's just the way to do it. So there is a 3-night cruise October 12th and a 7-night cruise on October 15th. And I love how Chris puts it together. He puts all the pricing in. So if you've ever been on an internet search for a cruise, they show you this great lead-in price, and then you click, and it says, here's how much your government taxes and fees are, and then you click, oh, but I need Wi-Fi on board, and then you click, oh, but I want the drink package, and then you click, oh, but I want to pay gratuities because I'm going to have to pay that sooner or later. I got to have travel insurance. He just puts all that in, and it's still a great price. So you got to call Chris. You can find out the information at Helping Seniors Travel Club.com, Helping Seniors Travel Club.com, or you could call Nancy Deerdorf on our Senior Information Helpline. She'll get everybody connected, 321-473-7770. It's just a great number to have. Maybe you missed the number to reach Denise or the number to reach Tami about their respective businesses, Senior Care Authority or Practitioners in Motion. Call Nancy. She's got all that at her fingertips, so make sure you get connected on that, the Travel Club Cruise, or even your tickets for the 7th annual Helping Seniors Car Raffle. This all winds up October 7th at the American Muscle Car Museum. And when you get a ticket, one for $25, 5 for $100 donation, that gives you a chance to help us in the Helping Seniors world because it's a donation. Number 2, it gives you a chance to win a brand new car that night. I'm going to talk about that in a second. And 3, it's an invitation. You don't have to be present to win because we pull the winning ticket. That's it. No muss, no fuss. That's how it rolls. But you are invited to the grand drawing event Saturday evening, October 7th, 6 p.m. to 9 p.m. at the American Muscle Car Museum. That is a fantastic evening just by itself. But you also, if we pull your ticket, and I hope we do, you will find that you get to have a choice of car. So the choices could be a brand new Dodge Challenger from AJ Hires Automotive Group, a brand new Chevrolet Camaro. And they're saying, guys, that this could be the last year for those cars as gas models. We'll see what happens, but that's what they've announced. You could take a Mazda Miata convertible, which is a pretty spiffy little car. You could also take the practical and stylish Kia Sportage, or even this year, because AJ has added a Mitsubishi dealership, you could choose the practical, stylish Outlander, which is a cool little mini SUV. So now it's quiz time. Denise Bergman from Senior Care Authority. I haven't asked you, which car of those would you pick if you were the winner?
Oh, my goodness. Well, I would probably have to ask my daughter because she'll be driving soon. But I'm going to go with, oh, boy. We'll say the Miata. That sounds like a lot of fun.
That is a cool little car.
Yes.
Every time we take that out to a car show, it's like you put it on. It's almost like putting on a suit of clothes because it just kind of wraps around you. And then you just look cool tooling around in it. It's a fun car. How about you, Tami Leeberg? What would you take?
I would love the Miata, but I have a Camaro already, so I'll probably go with the SUV for my grandson.
Aha! Well, see, there you go. Now, last year, our winner, she actually took home the Camaro, so it'll be fun to see what you pick when you win this time. Got to get your tickets, HelpingSeniorsCarRaffle.com. Call Nancy Deerdorf, 321-473-7770. You can go by any Boniface Hires dealership and get tickets there. You can come by our office, 1344 South Apollo, Suite 2C. We got them there for you. That's the time we have for Helping Seniors today. Thanks so much for being with us. Hope you have a great week. We'll see you next Wednesday.